Good afternoon, ladies and gentlemen. I'm Dr. Warren Low, consultant urologist. My specialty is neuroreconstructive and female urology, as well as robotic urology. Today, I'm actually very happy to have a patient, Miss Fatiha, who has collected all the questions that she's been keeping all this while. And she's going to question me a few things commonly asked by patients that's seen in my ward.
Hi doctor, good afternoon.
Good afternoon.
Okay, my first question. I have been suffering from urinary leaks for a few years now. It started after the delivery of my fourth child. My friends told me that I could be having a urinary tract infection. However, my urine tests seem to be normal. Whenever I cough or sneeze, my urine leaks, and whenever I feel the need to go to the toilet and can't make it in time, my urine would leak too. It is greatly inconvenient to me as it affects my daily life and affects my career and relationships. I am also spending a lot of money buying adult diapers. I have been avoiding social activities and have been suffering in silence. So based on this question, doctor, can you briefly explain what is urinary incontinence?
Basically, urinary incontinence is an involuntary loss of urine. That means to say that the patient leaks urine unintentionally as well as involuntarily. So whenever a patient encounters a situation like this, we will always ask a very good history of how this occurred, when it first started, and what type of incontinence that they are suffering from. Because as you know, we actually have 4 types of urinary incontinence. The first urinary incontinence is overactive bladder with urge incontinence. The second incontinence is stress incontinence. The third one is overflow incontinence. And of course, the fourth one is a mixed urinary incontinence. Now, the overactive bladder with urge incontinence essentially is an involuntary urine leak. Whenever you think about going to the toilet and you can't quite make it in time to the toilet, then you have this urine leak. So this is related to overactive bladder. Whereas the stress incontinence is essentially an incontinence that happens the moment you stress. For example, if you exert yourself, carry heavy things, cough, chronic constipation, you need to strain, then the urine leak, even you sneeze and even if you were to laugh out too loud. The third incontinence is an overflow incontinence. Essentially happen in those patients who have urological disorder. For example, those patients who have spinal cord injury, who have Parkinsonism, who have strokes, Alzheimer's disease, or even patients with diabetes. And then the last one is mixed urinary incontinence, is essentially a blend of everything. Well, I think that what you have could be a mixed, because you have urge incontinence, you feel the need to rush to the toilet, as well as you have this incontinence whenever you cough or sneeze.
Okay. My second question, what are the probability of a woman or man suffering from urinary incontinence?
There are about 15% of population in the world suffering from urinary incontinence. So in Malaysia, 1 in 10 women are suffering from urinary incontinence. In men, it's about 1 in 30. So elderly people, about 15 to 20% of them are suffering from incontinence in Malaysia. So it is not something which is unusual. So a lot of people are actually suffering in silence. They think that it is something that they can actually hide it or they can treat conservatively. But I think it's always good for the patient to come on to us so that we can actually explain to them, to help them to differentiate different types of urinary incontinence, because different incontinence have different treatment options.
Okay. The next question, are there any tests that help to identify the types of incontinence one is suffering from?
Yes, absolutely. First of all, when the patient first tell us that they have incontinence problem, what we will do is that we will ask a very thorough history. We would like to find out whether incontinence is associated with exertion or is it associated with some urgency and frequency going to the toilet, as well as trying to rule out the urinary tract infection, because whenever we have urinary tract infection, it can actually provoke the overactive bladder, and that can lead to urge incontinence. So the history is very important, and following that, we would like to find out whether the patient have any other underlying problem, for example, diabetes. As I told you before that, the diabetic patient usually end up with overflow incontinence, and if the patient have previous history of surgical intervention, for example, neurological intervention, spinal cord injury or spinal surgery, or even brain surgery, then that would actually give us a different type of incontinence as well. So apart from these physical examinations and history, we would also like to perform blood tests to see the kidney whether it's actually functioning well, and also to rule out the urinary tract infection from the urine test. And of course, lastly, we may actually suggest to get a scope done, which is a scope into the bladder. And if the patient still come up with a rather equivocal diagnosis, then we would actually suggest the patient to go for urodynamics, which essentially is a bladder function study. And these bladder function studies will help us to differentiate different type of incontinence, whether the patient is suffering from just urge, stress, or a combination of all the incontinence.
I see. Can you explain more on how urodynamic studies is done?
Yes. Urodynamic studies, basically, as what I mentioned to you earlier on, is a bladder function study. So sometimes when the patient told us that they have urinary incontinence, what they have is empty something else. For example, if the patient presents to us with urge incontinence, we would have thought that this patient have this urgency frequency. Now, urge incontinence, the treatment option is actually medication to start off with. But sometimes when we do the test, we find out that the patient is actually having a stress incontinence instead. So sometimes the history may not be all that reliable. So in order to find out whether the patient have just one type of incontinence or different type of incontinence, we use a bladder function study. So during the bladder function study, essentially a daycare procedure, what we do is that we put a tube into the bladder and also another tube into the rectum. Then we will infuse the water inside the bladder, and then we will see the bladder activity. As you can see from here, this is a graph that shows the patients with overactive bladder. So there are a lot of bladder activity here. So in a normal patient, you should not actually be having all these waves. So once you have all these waves shown up on the graph, that means to say that you're suffering from overactive bladder with urge incontinence. So bladder function study is a very good test for us because it usually tells us all types of urinary incontinence, and on top of that, it also will help us to rule out the possibility of a wrong treatment, especially when patients has been given different type of options by other doctors or different medications.
Okay. What are the causes of urinary incontinence and who is at risk?
Well, the causes of urinary incontinence depends on what type of incontinence we're talking about. If you're talking about the urge incontinence, usually it's because of caffeinated or even carbonated products. And of course, for those patients who consume too much water, sometimes we would have thought that they actually have frequency urgency because of this urge incontinence. In actual fact, they're probably just over drinking. So number one, make sure that we do not overdrink. Stay put to about 2.5 liter a day. I think that is good enough. About 7 to 8 glasses a day the most. Because if you were to overdrink, you end up going to the toilet many times. And that makes you think that you actually have urge incontinence, which is totally unnecessary. And then the urge incontinence can also be because of brain problem, for example, neurological disorder. Those patients who have strokes, Parkinsonisms, or even a spinal cord injury can also give you the urge incontinence. So from the physical examinations and the history from the patient, we should be able to identify the cause. Now, the second one is stress incontinence. Stress is not mental stress. Stress is every time when we exert ourselves, for example, cough, strain, when you laugh out loud, when you sneeze, the urine starts to leak, and it is actually a very common thing for women. So when it comes to stress incontinence, those patients who actually have very stress incontinence are those patients who have multiple deliveries, instrumental deliveries, patients who are very obese, who have previous operation done that has destroyed the nerves in the pelvic area for some reason. And of course, for men, the patient can also have stress incontinence up to about 5% after the prostate surgery for normal prostate enlargement, and probably up to about 90% for those patients who have prostate cancer surgery. So it can actually happen both in men and women as well. Now, overflow incontinence, the causes are because of unreactive bladder. Now, some medication can induce unreactive bladder. For example, sleeping pills, antidepressant, antipsychiatry, anti-asthmatic, antihistamine, flu tablets, all these medication can cause underactive bladder. So when the patient have underactive bladder, they are not able to empty the bladder. So ultimately, the bladder become overfilled and eventually leak. So this is what we call overflow incontinence. It's an overfilled bladder and ultimately leak. And of course, overflow incontinence is also one of the common things that happens in those patients with diabetes and other neurological issues. For example, those that I mentioned earlier on, even for strokes, Parkinsonism, they can actually present with underactive bladder apart from overactive bladder as well. And of course, the last one is a mixed incontinence whereby everything comes together.
Okay. Next question. What are the complications of urinary incontinence?
Well, I think a lot of people will be very weary about incontinence because of the fact that it's a social embarrassment. because whenever you leak, it's inconvenient for you because you need to change your underwear and you may have to end up wearing the diapers. But at the same time, we also will be worried because the urine smell will be a social embarrassment as well. So you tend to shun away from the social circle. But at the same time, we are worried, most importantly, urinary tract infection, because when you have this urge incontinence or stress incontinence, you tend to wear your diapers or you tend to wear your underwear. And if you don't change it in time, you will end up with urinary incontinence infection. And ultimately, this lower urinary tract infection can actually ascend up to the kidney and cause kidney infection as well. And of course, if you don't change all this in time, you will end up with skin infection. It can be bacterial infection, fungal infection, dermatitis and all. So these are the complications.
Is there any treatment for urge and stress incontinence?
Well, it is very important to differentiate the different type of incontinence because they are completely different. For those patients who suffer from stress incontinence due to heavy exertion or chronic straining, those people, the first line of treatment is, of course, lifestyle modification. If it is because of an obesity, lose weight. So if you are actually constantly carrying heavy things, then you probably want to carry something lighter. Then, if you have chronic constipation or chronic cough, you may want to seek treatment for all this because you do not want to constantly challenge your pelvic floor muscle. Now, if it doesn't work, then the next line is actually pelvic floor exercise or Kegels exercise. So all these physiotherapies will help to strengthen the muscle and curb the progression of the incontinence. And let's say if it doesn't work, as you can see on my table, there are a couple of things here. So number one, you have the sling. So sling is actually advocated for those patients who have tried out conservative treatment but never really work. Then in that case, what we will do is that we will actually put it inside, close to the pelvic area to strengthen the muscle and then to bring the bladder back to its original position. For example, if you were to imagine that this is a bladder and this is a urethra, and whenever the patient coughs, it just opens up and the patient has these urine leaks. So what you want to do is to bring this back up. That means to say that use the tape to hold the whole bladder up. So whenever the patient coughs, it doesn't open up. So it can stay like that forever. So this is actually a permanent treatment for many, many patients. It's a very good option of treatment. And it can be used for men as well as women. So you can imagine that. So there are some patients who have very, very bad stress incontinence, whereby this one may not work for them because they may have a very wide bladder neck as a result of trauma or even as a result of previous surgery. So in that case, we may advocate artificial urinary sphincter. So you can see from here, there's a balloon, there is a cuff, as well as there's a pump. So what we do is that this cuff, we put it around the urinary passage, okay? And then after that, the cuff is actually circling around the urethra. Now, the balloon is actually embedded inside the body, and the pump can be put either in the labia or even in the testicle. So with these things inside too, whenever the patient wants to pass urine, they just need to press the pump, and then the passage will open up and the urine comes through. So after that, about 2 minutes later, it will close on its own. So the patient just need to press whenever they want to pass urine, and after 2 minutes, it automatically closes. So you don't have to do anything anymore. So once we put it in, it's actually good because you know what, it lasts a patient a lifetime. And of course, this one is meant for those patients who have very, very severe urine incontinence, as in you are talking about using about 8 diapers a day. Okay? Now, when it comes to urge incontinence, as I told you before that, the cause is because of the caffeinated or carbonated products. So you may want to refrain from taking all these things. And then if it doesn't work, then we can advocate medication. That's the reason why it's important for us to identify different type of incontinence, because one is treated medically, the other one is treated surgically. So for stress incontinence, you have to use operation if the pelvic floor exercise or Kegel exercise failed. Whereas for urge incontinence, you can talk about medication. So the medication, what it does is that urge incontinence basically is an overactive bladder with leak. So the medication can help to relax the bladder a little bit, then the patient may not have any more incontinence. And that's the reason why it's important to differentiate different type of incontinence. So if the patient has been tried out different type of medication, it doesn't work, then the next one is to inject the Botox into the bladder. It sounds horrible, but it's actually about 5 minutes procedure. We know that the Botox aims to relax the muscle. So when you inject the Botox into the bladder, it actually helps to relax the muscle. It is not paralyzing the muscle, it just relaxes it a little bit. Then the patient will not need to take the medication. The only thing is that the Botox effect doesn't last very long. It usually lasts for about 6 months. It can go up to about 9 months to 1 year, depending upon how severe is the overactive bladder. Now, suppose if the Botox doesn't work, is there any other thing? Now, you can see that I have a little gadget here. This is actually a bladder pacemaker or sacral neuromodulation. So what we do, this is actually not the gadget that we put into the patient. This is the gadget that we put into the patient. So once we put it in, this little battery will send all the signals, the impulse, to stimulate the nerves that control the bladder. So if the patient has very, very severe overactive bladder, by placing this battery inside them, they actually can have a normal bladder function. So this is basically a Bluetooth. It's like a car remote control. So if you want to stop it, for example, some women halfway through, they end up pregnant. So they do not want to carry on with that. If they want to stop it, they just place it just beside the bottle and then tick tick, and then the thing is off automatically on its own. So it's a very, very useful thing. It's usually the last option for very severe overactive bladder. But also, it can be used for underactive bladder. As I told you before that, the third urinary incontinence is an overflow incontinence. Essentially, it's an underactive bladder. So if you have underactive bladder, is there any medication to make the bladder contract so that the patient can pass urine? Absolutely no. Because if there's such a medication, nobody will end up using a catheter. So right now, the mainstay treatment for underactive bladder is actually urinary catheter. So if a person do not want to use a urinary incontinence, urinary catheter, is there any other way that we can actually help to curb the problem? Yes, there is. This is the one. So as I told you before that, bladder pacemaker or sacral neuromodulation can be actually used for severe overactive bladder on one end and underactive bladder on the other end. Okay, so I think that is about it for treatment options for a different type of urinary incontinence. So we have a few questions here. So, hi doctor, my father is 73 years old, got benign prostate enlargement, PSA elevated, but seems not a prostate cancer. It is already like that for about 3 years. So he also has dementia, Parkinsonism. I don't think he can undergo the TURP, and I give him tamsulosin, which is the medication for prostate, with the prescribed 0.5 milligrams, and now he urinates very often. Do you think it's better not to go for TURP? TURP is, by the way, surgery meant for benign prostate enlargement in this situation, or is green light still an option? Well, the thing is that if the patient, especially 73 years old, quite expectantly he's having a big prostate, because prostate grows with age. The older you are, the bigger the prostate is. So it is ever-growing organ. So you can't actually stop the progression of the prostate gland. But this patient, apart from prostate, also has Parkinsonism. As you know, why the patient have urine leak is because if you have a huge prostate, bladder followed by prostate. If the prostate is obstructing, the patient is not able to empty the bladder properly. So inadvertently, the bladder have to work extra hard to push the urine out. So it's turning into an overactive bladder with urge incontinence. So urge incontinence can happen in those patients with big prostate. But the other problem of his is that he has Parkinsonism. Parkinsonism is already a problem because you know why? Parkinsonism, usually they will give the patient overactive bladder as well as underactive bladder. So for us, it's important for us to find out what exactly is the patient having. If the Parkinsonism is giving an overactive bladder, then obviously on top of a big prostate already having overactive bladder, now add on with the Parkinsonism problem, the overactive bladder with urge incontinence can become a bit worse. The problem is that if you were to ask me about this prostate surgery, does it help? My answer is that it may or may not help. The reason is because if the patient has some form of a bladder dysfunction and you're looking at just solving one problem, which is a big prostate here, you are not able to solve the bladder problem, then the patient may still end up with incontinence. So my suggestion is that I think this patient should be examined, that's number one. Number two, to find out whether the prostate is a large prostate, and of course to rule out the prostate cancer, and at least by a prostate biopsy should do the trick. And the third thing that what the patient should go for is actually a scope or even a urodynamic studies, because I need to know whether this is a combination of a bladder dysfunction together with the prostate or just the prostate alone. Because ideally a patient with Parkinsonism will have some form of a bladder dysfunction. So if you were to ask me to suggest the prostate surgery, it's not going to solve the other problem because this is a combination of these two. Alright? So I hope this answers your question.
Do people with urinary incontinence often get skin infection?
Yes, because you know that if you have a urinary incontinence, most of the time you end up wearing diapers and you wet your underwear frequently. So if you don't change your diapers or you change your underwear frequently, then the skin will be constantly soaked with urine. You know that to avoid the skin from getting bacterial or even fungal infection, you need to either apply the ointment, a barrier ointment, or even cream to maintain the pH between 4 to 7. And do not rub every time when you actually clean the skin, because if you were to rub it too hard, you're going to tear away the skin surface. So this is not advisable as well. So you've got to change the underwear or even the diapers more frequently, and make sure that you use appropriate cream to actually protect your skin layer, because otherwise, once the infection sets in, it's a nightmare.
Is incontinence part of aging?
Well, a lot of people think that incontinence is part of aging. Unfortunately, incontinence is not a part of aging. It's not an inevitable part of aging, because every man, when they live up to about 100 years old or 90 years old, they should not leak, because we know that there are many, many causes of incontinence. So once you have identified the cause of the incontinence, for example, men with a big prostate causing overactive bladder with incontinence, treat the prostate gland with surgery or medication. The incontinence may solve on its own. If the woman has stress incontinence because of the weak pelvic floor muscle secondary to multiple deliveries or even pelvic injury, now once you have actually strengthened it with either physiotherapy or even surgery, then the incontinence will stop. So not that if you're old, you're supposed to leak. So I think that is the common perception.
Okay. My last question, doctor.
Yes.
Does pregnancy leave a lasting problem with urinary incontinence?
Well, the answer is no. It's because once the baby is delivered, most of the time the pelvic muscle will undergo sort of like automatically strengthen itself again. Of course, with some help from the physiotherapy. Okay, because everything will contract back to its normal state. Unless we are talking about instrumental delivery, whereby we have to use the vacuum or even the forceps to pull the baby out. Some form of an injury would have happened during that time, so that may result in a weak sphincter. Mostly, we will still ask the patient to go for physiotherapies and go for assessment from time to time. If the patient has been on physiotherapy aggressively and is still not solving the problem, then we may have to advocate different type of surgery, as what I've explained to you earlier on.
Okay.
All right. So I believe that's about it. The questions all asked and answers.
Thank you so much for your explanation.